Vermont AHEC's Let's Talk podcast, where we spotlight the people and programs shaping tomorrow's health workforce. I'm your host, Peg Bolgioni, and we're celebrating Vermont Health Careers Awareness Month. Each October, we highlight the many exciting health careers pathways in Vermont, from nursing and public health to dentistry, behavioral health, and more. It's a time to raise awareness, spark inspiration, and show students and career changers the wide range of opportunities available right here in the Green Mountain State. Joining us is future physician Molly Hurd, a medical student at the University of Vermont Larner College of Medicine. Molly is here to share her journey, why she chose to pursue a career in family medicine, and perhaps eventually practice in a rural community. Stick around. You will not want to miss this. Molly, it's a pleasure to have you on the program, and we're going to get started. So I'm going to begin with the first question. What initially inspired you to pursue a career in medicine, and how did your journey lead to medical school here in Vermont?
Hi, Peg. It's so nice of you to have me on this. I'm so excited to talk about this. I actually came to medicine a little bit late. My career has been this journey of following my passions. And so I actually came to Vermont before I decided to go to medical school. I came here for my undergraduate degree in neuroscience. And at the time, UVM was just a great place to learn neuroscience, and it was such a wonderful community. So I ended up here for my undergraduate degree. And I didn't decide to pursue medicine until well into my college career. And even at that time, I wasn't completely settled on it. It wasn't until almost a year and a half out of college, after I had finished my master's degree, that I even really committed fully to applying to medical school and starting this journey. Yeah.
Well, that's interesting. I've spoken to other medical school students, and they seem to have a similar pathway. It seems like some of them do get a little bit of a later start. They just don't go automatically from college right into medical school. I don't think that's as common anymore. Do you think?
I'm trying to think back to my own personal medical school class. I think maybe a third of folks went right out of college into medical school, but I think you're right. I think it's a lot more common now for people to take a year or a few years, like I did, between undergraduate and medical school. Um, I think it's a great idea to take a little bit of time. Medical school is really hard, and it's definitely a long journey after medical school as well to being a full-fledged physician. So I think knowing that it's definitely what you want to do is important.
Yeah, no, I totally agree with you. It is. It's a huge investment, both personally and professionally. So, why did you choose family medicine, and what draws you specifically to practicing in a rural community?
Yeah, I think I started thinking family medicine when I was the year that I was applying to medical school. I was also completing a certificate in integrative health at UVM, and I started really learning about preventative medicine and how can we stop chronic disease before it even starts. And as I got into medical school and started exploring different specialties, family medicine was truly the specialty where we do a lot of, like, preventative care is what we do. And so that really spoke to me. Additionally, growing up, I grew up in a rural community in Massachusetts. And so that's what drew me back into practicing in a rural community, because I personally understand the impact that family medicine has in those communities.
Yeah, yeah, I totally agree with you. I think that when you're a family practitioner, I think you need to know a lot about everything in terms of your patients and building those relationships and trust. Do you agree?
Absolutely.
And Can you share a memorable experience from your clinical rotations that solidified your commitment to rural healthcare?
Sure. I've been thinking a lot about this question, and it's tough. I did my clinical training in Connecticut, which is part of UVM's kind of sister clinical campus. And so my family medicine experience was a little more suburban slash urban than it would have been maybe if I had been practicing in Vermont. Um, but I think the overall vibe that you get on your family medicine experience is incredible. These longitudinal relationships that you develop with people, whether that be in a suburban setting or rural setting, are just incredible. Like having folks come into your office and knowing that you are just so invested in their longitudinal health. They come in and they share the the goal that they had set for themselves after your last visit and how they've made progress on that goal, and seeing the true like joy and pride that people have when they come into your office about something that they've been doing for their health is just a really cool experience. And I think that's just amplified in a rural community because it's just closer knit.
Yeah, I totally agree, and I also think that you probably treat several generations of the same family. I mean, does that happen in these types of rural medicine practices?
Oh, absolutely. It's tough as a medical student to see the continuity of care because we rotate through things so quickly. And so we don't often see these longitudinal relationships. We get the sense of them when we're working with the doctor that has a longitudinal relationship. But in searching for residency programs and now talking to a lot of doctors that work in these rural settings, it's really cool to listen to folks say like, "Oh, I'm now on my third generation. Like I delivered the mom and then the kiddo, and now the kiddo is having their own kiddos." So it's really cool to see how it spans generations.
Yeah, I can hear the enthusiasm in your voice when you're speaking about it. Clearly, you have a passion for this. Vermont Health Careers Awareness Month is all about highlighting paths into the health professions. What advice would you give to a high school or college student in Vermont who might be considering a medical career?
Yeah, I think I would kind of echo what I started with. I came to medicine what I would consider late. Um, but that also meant that I knew that it was the right path for me when I got here. So my advice to folks starting out or thinking about it is follow what you love to do. If that leads you to medical school, amazing. You'll be that much better of a physician for knowing that that's the place that you need to be.
Right. That's very well said. What about are there things that they should be doing in high school in particular? Because I'm thinking about when they start planning, applying to colleges and such. Should they be, taking more math and science? Should they be doing more internships? I'm just curious about what your thoughts are on that.
I mean, I'm definitely coming at this from a unique perspective of someone that did not structure their high school career to go to medical school, right? I just did what I loved to do. I was part of an environmental health um, club in high school, and I did a lot with that. I got a job when I was 16 at a bakery in my town. None of these things outwardly you could say prepared, like on paper, none of those things are medical. However, I gained a lot of life skills that I now apply to medicine. The thing about it is you will learn the math and the science. And if you like math and science and you want to take those classes because you love doing them, do it. Um, but I'm a firm believer that just any skills that you gain can be applied to medicine.
Yeah, I think what's really important I mean, health literacy, I think, is a huge component to medicine. Being able to explain to patients exactly what's wrong with them and how they can treat it and be successful, and to be compassionate, to be empathetic. I think those are really important skills that physicians need to have, I think, with their patients. And some of those things they're not learned in a textbook, like you said. It's something that you just acquire, through your own life experience. And what are some of the unique challenges and rewards you've encountered or anticipate in rural family medicine compared to a more urban practice setting?
Yeah, I think I've talked a little bit about the rewards of it. I think in a rural setting, you have a really unique opportunity to not only be a doctor and be providing care, but truly be a part of the community that you're serving. Um, and you're part of so much more in that community than just a part of the medical profession. Um, and I think that is both a challenge and a reward. Certainly, I've noticed or heard from other doctors that it comes with a unique challenge of boundary setting with your patients, because there is a there is a line to be drawn of when you're a doctor at work and when you're a person at home. Um, but it's also extremely rewarding because you're seeing change in real time in the community, and you're also seeing the challenges that your patients face, and you're intimately familiar with the challenges that your patients face in the community. And so you have a better understanding and thus a better ability to affect change. Um, I think globally, some of the challenges of practicing rurally as opposed to practicing urban is your access. So rural communities tend to have less access to some of our more like sensitive imaging studies, for example, or specialist care. You are not, you don't readily have access to specialists, and often those folks will need to travel farther to see a specialist if they need one. And so I think that can, again, be both a challenge and a reward. Training and practicing rurally makes you a very competent family medicine doctor because you have to be for your patients. But when you need to engage with those other specialists, it can be more of a challenge.
Yeah. So, how has your medical education at the Larner College of Medicine at UVM prepared you to serve Vermont's rural population?
Yeah, I have loved my time at Larner. I think it's a really unique place to train because it has the added bonus of being a specialty, or like being an academic center and thus being fairly specialty heavy. And so, as someone going into family medicine, what I've done in my fourth year of medical school has been to rotate with a lot of the specialists that I may not have as good of access to, and thus I can learn a little bit more from. So I've rotated on maternal fetal medicine, so I've learned a lot about high risk obstetrics, which I can bring into my practice. Rotated with a cardiology service, which is something that family medicine sees a lot. So kind of adding that knowledge to my tool belt too. And then I'm working with orthopedics this month, which has been incredibly cool to see and learn about. Yeah, so it's been amazing to have that um, access to all of these specialty cares that I will eventually see, and it really is preparing me to help serve rural populations.
And looking ahead, Molly, what kind of impact do you hope to make in the communities you'll serve? I know you've touched on some of this in your earlier statements, but what keeps you motivated through the intensity of training and applying to residency?
Yeah, that's such a great question. I think in medicine, especially, there's this huge push um, to mitigate burnout. Um, And it's interesting, there's some research, particularly in family medicine, that keeping a full scope of practice actually mitigates burnout in family physicians. We get into this field because we love doing everything. Like, I am now looking at residency programs that will allow me to just keep learning and keep growing and get as much training as I possibly can. And so we go into family medicine wanting to do everything. But as we start to get overwhelmed with a large patient panel, we start to cut back. And the theory is like, oh, well, if you just decrease the number of things that you do, the burnout will kind of subside or lessen. But our research is actually showing that that's not the case. So that kind of keeps me motivated through the intensity of training. Like, I know it's hard, but I also know that the more that I know how to do, the happier I'm going to feel. And I think in terms of the impact I hope to make in my communities, I touched on this a little bit, but family medicine in particular has such a, it can make such an impact. Like, you as a physician, you might be one of the only physicians in your community. And so you really are a trusted source of information. In my medical school training, I've had such a great opportunity to work with physicians from all over the country. And one of the ones that always sticks in my mind, she's a physician in Kansas, and she is both a physician who works, she does OB, ER, and clinic. And then she's also she works for the Department of Health, and is like she started that role during COVID and was a huge proponent of disseminating information that people needed to know. And so she still works in the Department of Health. You also often in these communities are doing a lot with school and school-aged children, so education programs and working with the high school sports teams. So I think I just see myself really being in a community and being a part of it.
Well, and that kind of segues, Molly, into the next question about with the health workforce shortages being a real concern in rural areas. How do you see yourself contributing, not just as a physician, but as a leader or advocate for strengthening rural health systems, not just in Vermont, but wherever you end up?
Yeah, totally. I think it's really tough to it's I'm trying to think of the best way to phrase this. I think when
That's
we
right. Take your
start
time.
when we start look at becoming a doctor and we go to medical school, in the first couple of years of your training, really what you're thinking about is learning the medicine. So learning the pathophysiology, learning the diseases that you need to know, learning how to the different drugs that we use to treat things. And so that's really what we focus on in our first 2 years of medical school. And then in your third and fourth year, you're really seeing patients and you're seeing how more of these social determinants of health are affecting people. And that really becomes, I think, one of the major drivers of care in family medicine. I think we are probably one of the specialties that deals most closely with social determinants of health. And so we really do have to be a voice in advocating for our patients, not just for the medicine, but for how can our communities be supporting people in the best way. And so I hope to eventually practice in a rural setting, whether that be in Vermont or not, but just really be tapped into my community and fill whatever need is there. I think a lot of what I try to do these days as senior medical student going into residency is I wait for the need to come to me, and if I have a patient that says, oh, this is really just a challenge for me, or, oh, this is becoming a real problem in our community, just making space for that and saying, how can I help? Because I think we have the power to do that.
Well, selfishly, Molly, I hope you stay in Vermont because we need physicians exactly like you, with your, with your intelligence, your grace, and your passion, to treat the whole patient, to look at things as a whole. I guess you would call it what, holistic medicine, looking at the entire individual, versus just one particular thing that's wrong. Do you when I guess I'm thinking about your peers. Do you see the tide turning, that there's more interest in family medicine or primary care because there's such a demand for it, especially in small states like Vermont?
Yeah, I mean, I would hope so. I think UVM is really great about exposing people to primary care. It's definitely, if someone is going into medical school and looking for programs, because there certainly are medical schools that don't emphasize primary care as heavily as we do here. I think UVM is just a wonderful place to be for that. In the same vein, it's so funny how many people you would talk to, even some of the attending doctors that I work with now in these specialties like orthopedics, and they say, oh my God, I loved my family medicine rotation. It was like hands down the best rotation I had. Because it's just full of wonderful people who are so motivated and are just trying to make their communities better. Um, and so it is really interesting to talk to folks, even, and it comes up a lot for medical students too. Like, I loved his rotation, it was amazing, but it's very daunting to say that you're going to be an expert in everything. Or maybe not an expert, but at least have an understanding of such a wide variety of things. I think where people often get hung up is still kind of the pay piece, and just not, for the amount of work that we do. And a lot of times the work that we do is not necessarily direct patient care. Like I've mentioned, we do a lot of work in the community, we do a lot of advocacy, and those types of things are not necessarily compensated for. So I think folks get really daunted by the idea of not getting paid enough or that kind of thing. So I think that's usually the biggest barrier that I've come across for people not going into family medicine or primary care, which I think is changing. I think the culture of I hope the culture of our country is changing, because primary care is really where we're going to see a change in the health of the country.
Yeah. No, I don't disagree with you. I think that um, you're right. It's really the foundation of care. It begins, with primary care, and you have, said it so eloquently, and I really appreciate you sharing this with me today on the podcast. And I want to thank folks for tuning in to Southern Vermont AHEC's Let's Talk podcast, where we shine a light on the people and programs helping to build and sustain a stronger health workforce for Vermont. A special thanks to our guest, Molly Hurd, for sharing her story towards becoming a rural family physician. As we celebrate Vermont Health Career Awareness Month, we hope today's conversation piqued your curiosity, whether you're a student, educator, or someone considering a career change. Be sure to subscribe to our podcast, leave a review, and share this episode with anyone exploring the world of health careers. You can listen to us wherever you get your podcast. Until next time, stay connected and keep the conversation going.